for us at Metro, we utilize the state lab. And within the next 2 to 4 weeks, we will have the capability to test in-house, and the advantages of that is a faster turnaround. You know, 4 hours versus when we send it to the state, it can take 2 to 3 days.
Yeah.
And Michigan Medicine has started testing in-house 2-3 days ago, and other systems will continue to come online. And so the amount of testing available will greatly accelerate here in the next couple weeks.
Yeah. Well, that's good news. That's great news. Yeah, and then just the supply chain of masks and things and those sort of durable goods. To have one of the key, that's everyone thinks of healthcare providers with masks on, and that's one of the things we don't have right now.
Yeah, that's China in many ways has been our supply chain for a lot of things, and masks were one of those. And so I think, again, this is a tipping point for this country in the way we think about supply chain. We've been fortunate. We've really worked hard behind the scenes to secure enough surgical masks as well as the N95 masks that are used for airborne isolation. So we're in a good position with that. We're certainly willing to help out others if it came to that. But I think that mask situation is concerning. We follow it day to day. So in our incident command meetings, twice a day, how many masks do we have? How many days supply? We're in a good spot with that, but it is concerning, and I think it's going to change the way I think the whole country looks at where we get them, how we get them.
Sure. Yeah, and it just underscores the interconnectivity of this world. So we're seeing it play out in a pandemic and how connected we are and how easy it is to transmit things. But our supply chain for simple things, and what doesn't matter, it's such a global, tight-knit infrastructure now of how we get anything.
Absolutely.
Food versus, packaging to core supplies. It really just underscores how much we're connected as human beings. And how just one little disruption can really create a domino effect that you're quickly trying to
Absolutely
undo the bell. This Full Exposure Podcast episode has been made possible through the support of Metro Health, University of Michigan Health, and Dr. Peter Hahn, who believe that creativity and the arts are essential to a rich, healthy, and fulfilling life.